Have you ever noticed how your eyes work tirelessly to bring the world into sharp focus, whether something is near or far? Our incredible eyes adapt constantly, but sometimes, certain characteristics can create unique challenges. This leads us to a very important question many people ask. No, high farsightedness itself does not directly cause glaucoma. However, it is a significant risk factor for a specific type of glaucoma called angle closure glaucoma. Understanding this distinction is crucial for protecting your vision. To explain why, let us consider how your eye is structured. Farsightedness, also known as hyperopia, means that light entering your eye focuses behind your retina instead of directly on it, often because the eyeball is shorter than average. In eyes with significant farsightedness, the front part of the eye, which includes the iris and the lens, can be more crowded than in eyes of average length. This crowding can lead to a narrow drainage angle, which is the area where fluid normally flows out of your. If this drainage angle becomes too narrow or suddenly closes, it can block the outflow of fluid, causing a rapid and dangerous increase in the pressure inside your, known as intraocular pressure. This is the mechanism behind angle closure glaucoma. It is important to note that this anatomical characteristic does not increase the risk for open-angle glaucoma, which is a more common form of the disease. If you have been diagnosed with high farsightedness, proactive eye care is very important. You should have regular, comprehensive examinations where your eye doctor can assess your drainage angles. They might use specialized diagnostic tests like gonioscopy, which directly visualizes the angle, or optical coherence tomography, also known as OCT, to measure the angle's width. These assessments help identify if you are at risk for angle closure glaucoma. If you experience sudden eye pain, blurred vision, or see halos around lights, seek immediate medical attention, as these can be signs of an acute angle closure attack. It is fascinating to learn about the unique anatomical predisposition high farsightedness can create for angle closure glaucoma. For individuals identified as high risk, eye care professionals sometimes recommend a preventive procedure. This is known as a laser peripheral iridotomy, or LPI, where a tiny hole is made in the iris to create an alternative pathway for fluid drainage, significantly reducing the risk of an angle closure event. So, while high farsightedness does not directly cause glaucoma, it is a known anatomical risk factor for angle closure glaucoma. This makes regular eye checkups and a clear understanding of your eye's specific characteristics invaluable. By staying informed and proactive, you empower yourself to manage potential risks and preserve your precious vision for years to come.